So, good morning. So, we are, I'm opening the first lecture laying out all the foundational concept that shapes the field of artificial intelligence and digital medicine. And as I mentioned last time, digital medicine now goes with artificial intelligence. What is artificial intelligence? Or also known as AI. What is artificial intelligence? If there's an artificial intelligence, there is also what? A natural intelligence. What is an unnatural intelligence? Intelligence coming from yourself. Don't tell me you have artificial intelligence. Artificial intelligence only helps you. They are not the one should be thinking for you. Are we clear? Hello? Are we clear? So it establishes the conceptual grounding required before engaging with more advanced application. So our terminology here is what? Artificial intelligence, the guiding framework, technological principle define the contemporary digital health system introduced in a structured and coherent manner. So as we go by this discussion through the ways of artificial intelligence becomes embedded within clinical workflow, highlighting digital tools, generate process, transmit across different points of care. Attention is given to the influence of this technology. So on healthcare delivery, both at the level of individual patient encounters and within broader health system operation. So by the end of this lecture, there should be a clear understanding of the essential building blocks of digital medicine. Form, creating a foundation for deeper exploration of practical, ethical, and operational dimension of AI-enabled healthcare in the sessions following sessions. So these are my contents. This outlines and establishes the structure for the lecture, opening with a set of foundational definitions that anchor the discussion. From this base, the narrative progress into the core mechanics of artificial intelligence and machine learning, tracing the principle that enables this system to operate. The exploration then turns to the role of these technologies within healthcare environments, illustrating how they support clinical processes and why digital health has emerged as a global priority. So, we will be concluding with a clear overview of assessment, expectation, recommended readings later, and learning strategies that will shape engagement throughout the course. Together, these elements provide a coherent framework that guides the learning journey from a foundational concept to applied understanding. So, the objectives. This align closely to the broader learning outcomes of the course, placing emphasis on conceptual clarity and functional understanding. The material establishes a clear grasp of digital medicine, encompasses and outlines how digital health technologies operate across clinical and public health settings. Attention is directed not only towards defining key terms, but also towards examining the mechanism that enables digital tools to generate, process, and apply data in a meaningful and actionable ways. Through this focus, the objective provides a coherent foundational and understanding the technical and operational dimensions of digital health. Now, let's get to the first topic. What is artificial intelligence? The question that I asked to you. Name an artificial intelligence that you know. ChatGPT. DeepSeek. Copilot. Perplexity. Again. Turbo Learn AI. Anything else? Everything that you mentioned is an AI. Under that AI, we call that ML. What is ML? Mobile Legend, right? No, ML, machine learning. Those programs, those applications, you need to teach them what they need to do. Yes. You understood what I'm saying? Remember, you need to, if you ask ChatGPT, make me something like this. ChatGPT will just give a generic. But if you teach ChatGPT, ask ChatGPT, do you know something about this? Can we discuss about this? Then after some time, tell ChatGPT, can you make me something like that? A lecture or something? ChatGPT will be giving you much better. Remember, those machine learning learns by prompt. But there are some AI also, wherein it can suggest you, uh, wherein you don't need to teach them. It will suggest you what is right. What are you using to type? Again, for example, you're typing notes. What program are you using? Sorry, I can't hear. Google Docs. Then Google Docs, if you have a wrong spelling, what will Google Docs do? Like Microsoft Word, right? It will underline that spelling, telling you what? It's a wrong spelling. That's artificial intelligence. Next question. What's that? Again, what's that? It's a phone, right? Can you calculate something in that phone using the calculator, right? Now, I'll ask you to calculate using your brain, not the calculator. What's the logarithmic equivalent of 1000? 3. Log of 1000. Go. What is the log of 1,000,000? 6. It means to say I have an AI in my brain, right? No, that's magic trick. That's party magic. But then again, calculator is an AI, right? Am I right? Correct me if I'm wrong. Do you agree? So they should not say that AI should not be used in school because you're using calculator, you're using Microsoft document or Google Docs, right? Microsoft Word, sorry, or Google Docs. It's not AI. It's not use AI, but you should limit yourself from using those machine learning. Because sometimes machine learning, because you did not teach that machine, what will happen? It will give you what? Wrong answers. Am I right? So artificial intelligence encompasses a broad set of computational techniques that allows machine to perform functions traditionally associated with human cognition. Again, human cognition. because you're teaching them. These functions include identifying patterns in complex information. Yes. Making prediction based on historical data, classifying signals or images, generating recommendations, and continuously improving performance as new data becomes available. And unlike conventional software, which follows fixed rules, AI system learns from examples, adjusts to variability, and can generalize to new situations. In healthcare, AI serves as the analytical engine behind many modern digital tools, and it enables to process vast amount of physiological, behavioral, imaging, and environmental data that would be impossible for humans to analyze manually. I would like to correct really the book. It's not impossible. It's still possible, but it will take what? Time. With the dawn of this machine learnings, with the dawn of AI, most of the time, what happens to your job? Your job decreases. The complexity of the job decreases. Not the job decreases. Like I told you, in the near future, AI wouldn't replace human beings. But human beings who knows how to use AI will be more sought than those people who don't know AI. Am I right? Am I right? Okay. How good are you in using your machine learning? Last time I asked you what are your machine learnings. How good are you? Give me a prompt. How do you ask your chat GPT? Any volunteers here? I would like to know. Hello? Hello? Yes, hello. No one wants to answer. Who wants to answer? Again, class participation is graded now, huh? Who wants to answer? How do you give me a prompt? How do you use your chat GPT? Give me a go. Give me an example of how to ask. Give me something that you don't use in school. You want to ask something. Wow. That's spying. Espionage. I think I would like to go to your tutorials rather than that. Okay, go. Tutorials. You ask your chat GPT for your tool. That's one good way how to ask. Ask for websites and ask for the link. Why? Most of them give you bogus website if you just ask the website without the link. Most of them will give you bogus journals if you just ask without you understood what I meant. So AI models can detect subtle trends, yes, highlight abnormalities and provide decision support in ways that enhance and again do not replace clinical expertise. Have you tried asking ChatGPT any clinical problem? Give me an example. Mm. So I only have one student. How do you ask them? What are the parameters you're giving when you ask for case studies? Age, symptoms, what else? Agree. You need the age, the symptoms, what else? Ah, lifestyle. It's like what? Asking the history, right? Have you the who lectured you about the patient? Who? Who? Who give their appropriate advice? Okay, Mrs. Google. Who lectured you about vital signs? Dr. Sakyusa. Mm. Right? You can do that. Ask ChatGPT. The big question is, will ChatGPT give you the management? No, right? They won't give you the drug. I tested that. They won't give you the drug. They won't give you the dosage. The only management that ChatGPT will tell you is what? Immediately go to the hospital and let the doctor. You understood what I meant? Okay. So this capability underpin applications such as wearable-based monitoring. I think I saw someone wearing a smartwatch here. Who was there? Can I see your watches? There is someone wearing a smartwatch. What is a smartwatch? It's a kind of watch that measures your blood pressure, those things. And there are smartwatch measuring your sleeping pattern. Yes. Base monitoring, predictive risk scoring, automated image interpretation, natural language processing of clinical notes, and personalized treatment recommendation. AI also play a key role in automating routine of repetitive tasks such as triage sorting. What is triage? If in a hospital someone comes, again, I don't mind you using your laptop to look for your answers on the questions that I am asking or your phones. But the big question is the answer correct? Triage is something when a patient comes, you will see it if it's emergency, non-emergency, or it can take a while for the person to wait. Okay, I'll tell you an experience of mine. I was in the ER on duty and there were five patients. All five came in. One is having a stroke, a what do you call this? Blood vessel ruptured on the head. That's a stroke. Another one is having heart attack. Another one is a gunshot wound. Another one is a stab wound. And another one is a asthma. Of all those five, which one should you see first? You're only one. You cannot see them all. Again, heart attack. You know what's missing? You didn't ask me a question. What is that question you should have asked me? No, no, no. All of them went to the ER at the same time. No, No, you did not ask me two critical questions. Okay, what are the five patients' problem? Again, yes. Who's this? Can you close the door if you're not going in? Again, what are the five patients? Okay. What is the critical question to be asked there? Yes, all together. Yes. It's something like that, but they are not in a group. What question should you ask me on those five patients? No. What's his name? Neo. What question should you ask me? I would like you to sit here because you're late. Bring your things. Yes. What question should you ask? No one's asking Chat GPT, right? What question? The triad protocol is there, but what is the question? There is something wrong with those patients that I told you. And what did I miss? They're alive, barely someone is alive. What is the thing? Don't care the gender. I'll look at them even if they are LGBTQI plus plus. I don't know. Whoops. What happened? Okay. So, what will you be asking? Yes, you didn't know that I can do this. Say hi. Wait, it is unfair for Nia. Hi, say hi, Nia. Okay. Gunshot wound. Where? Stab wound. Where? Right? Okay. No, it's here. Heart attack is here. Asthma is in the lungs. Am I right? Wow, I hear no. Is Jerryson here? Okay. Where's that stab wound? Ah, no, in the arm. Where's the gunshot wound? No, on the foot. Okay, now which one will you be starting to look at? The heart attack and the stroke. Same. I put the heart attack, give the heart attack what? Oxygen. The stroke, give them what? Oxygen also. Then stat for CT scan. That's around 2 a.m. Huh? Stat for CT scan. Next, after that, the asthma. Give them, give the asthma oxygen and salbutamol. Now, the gunshot and the stab wound was the last person I saw because it was in a non-lethal place, right? Yes. I just clean the wound and stitch, then pack, give them antibiotics, pain with painkiller. The gunshot wound, what I did was I incised in the ER and took out the bullet. Then sutured. That's how you manage an ER. Are we clear? Now, no, because in my report, they said my face was not seen in some of my lectures, so I need to do this now. Bring my laptop with you. So, preliminary data allowing clinician to focus on higher level reasoning and patient interaction. And however, before diving into specific tools or use cases, it is essential to understand AI at a conceptual level. What it can do, how it learns, and where it excels, and where its limitations lie. This foundational understanding ensures the clinician can engage with AI critically, responsibly, and effectively as it becomes increasingly integrated into digital medicine. Wow, it took us 21 minutes for that slide. Hey, okay. Next, how AI works, the data, the algorithm, the learning cycle. As I told you, those in any AI they learn. Even your calculator, there is what you call what? A programmable calculator. Am I right, Neo? Have you seen a programmable calculator? When? Where? Noeli. Noelani. Ah, Noela. Who's Noela? Noela. Have you seen a programmable calculator? Where? Yes, on your phone. You want a much more better programmable calculator? Your Microsoft Excel. Your Google Sheet is a programmable calculator. Did you know that I made a program using Excel to do statistical analysis? Yes. Yes? No? Did you know that? Okay. So AI system depends fundamentally on data, not just as raw input, but as foundation from which they learn patterns, relationship, and decision rules. So in every algorithm, whether simple or highly complex, follows a set of computational procedure that determines how it processes information, extracts features, and generate outputs. This procedure defines the logic of the model, shaping how it interprets signals, weighs evidence, and responds to new cases. So the development of an AI model follows a structured learning cycle. During training, the model is exposed to a large data set with no known outcomes, allowing it to adjust internal parameters and learn associations. And this is where the model forms. Its understanding of what patterns matter and how different variable interacts. After training, the model undergoes validation where its performance is assessed on separate data to ensure it is not simply memorizing example, but is learning generalizable rules. And finally, testing evaluates how well the model performs on entirely new unseen data, a critical step for determining whether it can functionally, reliably in the world settings. So this iterative cycle, train, validate, test, and refine, is repeated many times. Might be a billion in 1 second. Each iteration helps the model correct errors, reduce overfitting, and strengthen its ability to generalize across diverse population and contexts. Continuous learning and periodic training are essential, especially in healthcare, where disease pattern, patient demographics, and clinical practices evolves over time by following this cyclical process. AI systems maintain accuracy, adapt to new information, and remain clinically relevant even as the environment around them changes. In short, this AI can just follows the pattern and how you train them. They can easily look for the pattern. And again, it depends on how you train them. So machine learning represents one of the most transformative branches of artificial intelligence because it allows systems to learn directly from data rather than relying on rigid rule-based programs. Instead of specifying every possible condition or decision pathway, developers provide the model with large dataset from which it can infer patterns, correlations, and predictive signals. Through this process, the model builds an internal representation of how different variables relate to another one, enabling it to classify new information, estimate risks, or forecast outcomes. So, a defining features of machine learning is its adaptability. As models are exposed to more data, especially diverse real-world clinical data, they define their internal parameters and improve their performance. So this makes machine learning particularly powerful in healthcare, where data streams are continuous, heterogeneous, and constantly changing. New diseases emerge, patient demographic shift, diagnostic technology evolves, and clinical practice adapt. Machine learning can incorporate these changes through training and recalibration. Again, retraining and recalibration. What does it mean? As I told you, those machine learning, you need to train them. You need to educate them what they need to do. Recalibration. If this is the normal is being skewed going to abnormal, either negative or positive, they need to what? Go pull those things going to the normal. You understood what I'm saying? For example, this is the normal one, right? And slowly your AI is going to a abnormal answers. Again, even AI can commit mistakes because it's not like trained like that. You need to recalibrate them. You need to teach them again how to go there. You understood? It's like the students. Even if we're talking a lot, some of them still don't understand what we're saying. They say yes. So we need to pull them back. You understood what I'm saying? Now, am I right? Are you sure? Am I right? Yeah. Try to see. Before, what's the year today? 1946. 2023 was the boom of machine learning site ChatGPT. If you ask ChatGPT what's how many are installed today, before ChatGPT will only say how many are installed today. Count. You know, no, they connected it already. But count how many are installed today. S more. How many are? SPR. A W B E R R Y. How many? Three. Before that, BPP says two, and it's always debating that there's only two. Next, have you seen ChatGPT play chess? Look at in YouTube. You'll see a lot of YouTubers playing chess with ChatGPT, and it's what do you call it? It's not following the rules of chess. That's why, as I told you, you should what? Teach your AI. You need to calibrate that AI before. You understand now what I'm saying? Okay. Maintaining relevance even as the healthcare landscape evolves. That's why it's really, really important for you to know what is basic. When you don't understand something, go to the basic. Am I right? What is 1 plus 1? What is 2 plus 2? What is 3 plus 4? What is 2 plus 3? What is 3 plus 3? What is 4 plus 3? Ah? Hey, why? I'm learning for this from this generation. Now I'll ask you, what does it mean? What does it mean? I don't understand that. When I look at it in a lot of dictionary, they say it's a nonsense word, right? But last year, that was the word of the year. Did you know that? For me, if you'll be asking me what the 6-7 means, it's like, have you watched Hotel Transylvania? You have watched Count Dracula there. What did Count Dracula always say? Blah, blah, blah. So for me, 6-7 is like that. Am I right, Nia? In clinical practice, this capacity for continuous improvement underpins many modern digital tools. Risk prediction models, wearable-based monitoring system, automated image interpretation, and personalized treatment recommendation. So by learning from patients that may be subtle or complex for human to detect, machine learning augments clinical judgment and support more precise data-driven decision making. However, its effectiveness depends on the quality, diversity, and representativeness of the data it learns, from reinforcing the need for careful validation, governance, and oversight. Am I still with you? Are you sure? Neo, what you can understand? Everything? That's 7 minutes of everything. Okay, fundamental of machine learning. Basing on the word machine learning, what does it mean? The machine learns. That's why they are called what? A no machine. That's why they are called machine learning because the machine learns. No, no, no. Right? Machine learning. Give me an example of machine learning. Sorry, but you mentioned that that's good. Can I? Yes, ChatGPT is a machine learning because you need to teach them what to answer. You know how to teach your ChatGPT, your Copilot. I don't know perplexity, but perplexity is not good. I don't know Gemini is not good. DeepSeek, you know how to teach them. No? Keep asking the same question. No? Let them read the book. No, no, I'm not joking. Let them read the book. Upload the book. And then ask the question. Now understood. They get documents. There's one problem. All of those machine learning can only accept 50 pages. how would you give it? Yes, upload 50 pages. But that's PDF. Already set up PDF. Again, still you can only upload 50. You speed share the page one by one.
How much is the content?
It can only accept, I think, up to 20,000 words. That's why you need to upload much more. You use another AI that can separate the pages. Yes. What AI? That's beyond my scope. So you understand now? This is a subfield of AI. There's a lot of AI. Like I told them, what's the most common AI you are using? No, that's machine learning. Yes. But I doubt it that that's the common AI, right? That is used. Can I have your hand? What's the most common AI now you're using? And it throwing. Again, what's the most common AI you are using? So you use ChatGPT more than your own. So how do you access ChatGPT? You understood the answer to the question. Yeah. Again, what's the most common AI you are using? Your phone. Yes. Or the laptop. Okay. Yeah. Your phone. What's this? Your Android phone is an AI. Remember now? Yes. You were late when I was mentioning that to us. But that is an AI also. Okay? Are we clear? Modern learn patterns from data. This is what mentioned to you a while ago. You give them you teach them something, they learn about those patterns. Improves performance without explicit reprogramming. You just give them what? The book. They don't know what to do. Raise your hand. You know that there is an AI in healthcare. Who knows that? Raise your hand. Okay, good. Don't use that. Why? The best intelligence is still one. The human intelligence. AI won't work without human intelligence. You want to do you want to learn how to think like AI? Like a while ago, I gave you a demonstration, right? Let's use Neo. Neo, give me the log of the logarithm. Calculate in your calculator. 1 billion. Let's use 1 billion. 1 billion. 9. Billion. Or use your laptop. Ask Google, what's the log of 1 billion? 9. Am I right? Do you know the pattern? Number of zeros. Okay? Let's now do this. What's the log of 125? 2.0. 2.01 or 2.01? 125, right? Am I near? Yes. Hmm. Am I am I correct? Or am I near? I told you that's party magic. I was a magician before. Yes. You want to see a magic? You'll see yourself next year here. I'm just joking. Are you now all awake? You know the magic trick there? No. Okay. Machine learning in healthcare. This is the one that I have mentioning you. An AI in healthcare. In healthcare, machine learning operates through several methodological approach, each offering distinct strength. And depending on the type of data, the clinical question being addressed. Number one is supervised learning. It is the most commonly used approach in clinical AI. It relies on labeled data set, for example, images tagged as normal or abnormal, or patient records labeled with outcomes such as developed sepsis or did not develop sepsis. By learning from this known example, supervised model can perform tasks such as diagnosis, risk prediction, triage prioritization, and treatment recommendation. And this approach mirrors traditional clinical reasoning. The model learns patterns associated with specific condition and applies them to new patients. Next one is unsupervised learning. In contrast, works with predefined labels instead of predicting specific outcomes. It identifies hidden structure, cluster of relationship within the data. In healthcare, this is particularly valuable for discovering previously unrecognized patient subgroups, detecting early diseases signature, or identify behavioral pattern in large populations. For example, unsupervised clustering can reveal distinct phenotypes of heart failure or sepsis that responds differently to treatment, insights that may not be obvious through conventional analysis. Other methodological approaches also play important roles. Semi-supervised learning leverages a mix of labeled and unlabeled data, which is especially useful in healthcare where high-quality labels are scarce or expensive to obtain. Reinforcement learning. Later, I'll discuss to you in my own words. I'm just telling you what the book is saying, then I'll discuss to you in my own words. Reinforced learning enables systems to learn optimal action through trial and error feedback, supporting applications such as personalized dosing, strategies, or adapted treatment pathway. So the clinical relevance of these approaches lies in the ability to enhance decision making, improves efficiency, and support personalized care. So machine learning models can process vast, complex data sets far beyond human capacity, uncovering subtle patterns that inform earlier diagnosis, more accurate risk stratification, and tailored intervention. So when integrated responsibly, this tool augment rather than replace. Again, what do you mean by augment? What do you mean by augment? I see a lot of you have your laptops out, your cell phones out, but what? You're not using it. As I mentioned a while ago, you need to use your gadgets accordingly. What is augment? Yes, augment. Like Neo, he has a laptop and his cell phone is out, but he's not using it when I asked it. That's augmented. I'm just asking what is augment. Something like that, right? Enlarge, increase, or supplement what you learn, what you know. Am I right? The problem is, what if you don't know anything and you use AI? You'll just trust what AI will tell you, right? There are times, to tell you frankly, I'm debating with AI, the machine learning, ChatGPT and everything. I'm debating. Why? They are giving me something wrong. Augment, AUGMENT. Clinical expertise, helping clinician deliver safer, more precise, and more patient-centered. So let's go back. Supervised learning is this. This is an example of supervised learning. I'm here teaching you. Am I right? You understood now what supervised learning. Unsupervised learning, in contrast, I give you the modules, you read. To tell you frankly, I can do unsupervised learning. Why? I gave you the books, you read. And I expect you in the exam, you pass. Am I right? That's unsupervised learning. We can still do that. Do you want to? Semi supervised learning, something like I teach you, then I give you the notes, you read the notes all by yourself. You understood? Then reinforced learning, reinforced learning, you know now that things. You know everything, but you still attend because you are trying to augment what you have learned or enhance what you have learned. You understood? Do you understand those terms? Now, the global movement towards digital health is not a superficial trend, but a response to profound structural pressure facing modern healthcare system. What's the problem with the modern healthcare system in the world? Okay, but
Less resources.
what else? Lot of patient, less doctors, right? So population also is what? Aging. There is chronic disease rising. Name me ano chronic disease. Heart attack. Stroke. See, you know how to play charades, right?
Asthma.
Asthma. What's that? What's that? No, no. What were they were saying? No, it can. Or that's that's asthma. Neo is laughing. Huh? Chronic disease are rising. Patient expectation for continuous personalized care is increasing. Traditional models of care delivery, episodic, facility based, and labor intensive, are no longer sufficient to meet this demand. Why? Because there's a lot of patient, and each patient has what? Diseases. And they are in just in one room, right? What will happen? They might get that, yes, infected. And we don't know. At the same time, many countries face persistent workforce. As I told you, it's not only Fiji, in all countries face persistent workforce shortages, with clinicians experiencing burnout, administrative overload. Yes, when you become a doctor, that's one issue, burnout. Have you seen someone dying? Yes or no? To the point that they are dying and you see them being resuscitated. It's a traumatic experience, right? And increasing complexity in clinical decision making, these realities create an urgent need for tools that can extend capacity, streamline workflows, and support clinicians in managing growing caseload. Technological progress has accelerated this shift. Now, that's why there are sensors. Remember? They are putting sensors on you to monitor heart, those things. Wearables, smartwatches. Anyone here with a smartwatch? Anyone here is has a watch? Anyone here is smart? Everyone, right? Noella is still waiting for the punchline. Sensors, wearable mobile devices, cloud-based platforms. What do you mean by the cloud-based platform? I would like to ask Vicenza, what is cloud-based platform? You answered that question a while ago. Give me an example. Give me an example of a cloud-based platform. Google Docs. Google Docs is cloud-based and have become more affordable, interoperable, and user-friendly. High-speed connectivity and widespread smartphone adoption means that digital health tools can now reach patients in their home, workplaces, and communities. AI and machine learning analytical power enabling system to process vast dataset, detect subtle patterns, and provide real-time insights that were previously impossible. Health systems themselves are evolving. Administrators and policymakers increasingly prioritize efficient cost effectiveness and measurable outcomes. Digital tools supports these goals by enabling remote monitoring, reducing unnecessary hospital visits, improving triage accuracy, and supporting preventive care. Data-driven decision-making, once aspirational, is now essential for managing population health, allocating resources, and improving quality of care. And finally, digital health expands access, particularly for rural, underserved, or mobility-limited population. Telemedicine, remote diagnostic, and virtual care models reduce geographic and socio-economic barrier, helping health systems move towards more equitable care delivery. Together, these forces, demographic, technological, operational, and societal, create a powerful and unavoidable momentum. They make integration of digital health and AI not merely an option but strategic necessity for resilient, sustainable, and patient-centered healthcare. Any questions? Any questions? None. So I would like to leave you with this. Yes. Do you know that movie?
Yeah.
Actually, that movie is the one who introduced AI also. What are you taking pictures of that? Okay, go.
Alright.
But you should have told me so I can. Okay, again. Again. Okay. Then again, I'll be giving you the notes, right? what are you doing? SpongeBob. Sponge- yeah, SpongeBob SquareDance, right? So these are my resources. Set